डॉक्टर विवेक गुप्ता, दिल्ली अपोलो हॉस्पिटल से। तारीख है 19
रात अभी समाप्त हुई है, थोड़ी सी देर पहले। समय आप देखिए, ये हो रहा है रात के 1:30 बजे, 1:50 AM. So we are here working with our team of doctors in Apollo Hospital, Delhi, and we have a team of Dr. Kanchan. Dr. Kanchan, hello करिए. Then Dr. Amravati, Aravali from anesthesia team. Lalit, very important technician. And we have done an emergency angioplasty, primary angioplasty in a patient who had an acute MI, heart attack, acute MI, has a different pathophysiology. It has a serious problems of possibility of sudden death, hypotension, and of course repercussion of having a heart failure in the future. कहने मतलब है दिल का दौरा जो पड़ता है तो उसमें कई रिस्क होती हैं। उसमें एक तो सडन डेथ की होती है, दूसरा अगर बच जाते हैं तो हार्ट फेलियर होता है, हार्ट की पंपिंग कमजोर हो जाती है, और समटाइम एरिथमियाज which can lead to serious repercussion. When the patient arrives in a hospital like Apollo, we have two options: either we thrombolize, which is a clot dissolving agent, or we do urgent angiography and angioplasty and open the artery. So we always give an option, and nowadays we always prefer to do angioplasty. इसको कहते हैं primary angioplasty. This is more riskier as compared to normal angioplasty. It requires more skill, more backup support, और खास करके रात को 12 बजे के बाद अगर हो तो आपके खुद के पसीने आ जाते हैं. पसीने मतलब you also feel stressed, you don't want anything wrong to happen. So I came to the hospital around 12:30 and then we did angiography. मैं angiography के short दिखाऊंगा. It's very interesting because इनको पहले कोई symptom नहीं आया. She is non-diabetic female, 75-year-old, and she had no other symptoms. And first time she had घबराहट. ECG was taken in the emergency and that did not show major, at least did not show acute MI. There were ST depressions. ECG दिखाना doctor? Show me the ECG. But same time we repeated the ECG, but the symptoms were classical of angina. She said घबराहट हो रही है, छाती में दर्द हो रहा है, घबराहट बहुत ज्यादा थी इनको, and she was tachypneic also. Our emergency team, which had good CMOs, they diagnosed. The ST elevation was minimal, but still it was going in favor of acute MI, and she also had arrhythmias. तो हम लोगों ने आते आते सबसे पहले balloon pump लगाया. I always do one thing which I sometimes people think कि पहले angiography करो या पहले balloon pump करो. I show you the ECG. ये देखिए ECG है, and the ECG is having ST depression in the anterior leads, mild ST elevation in lateral lead, V6 and also L1. And this was repeated and it further showed ST elevation in V6 and in L1. That is a lateral lead supplied by circumflex artery. So first of all, I will take your comments also. We did a intra-aortic balloon pump. My son Dr. Vivek Gupta is watching this video. I left my food, खाना खाया लेकिन जल्दी खाना खा के आ गया. This is balloon pump. Balloon pump पे आपको देख रहे होंगे 171, 202. This is actually a diastolic pressure, 167. So balloon pump does give support to the patient who is otherwise chances of having cardiogenic shock. तो मैं क्या करता हूँ? I always do balloon pump before doing an angiography, and angiography के shots आपको दिखाते हैं. You can see this is a balloon pump. First of all, we put a balloon pump. You can see this balloon pump is having a this. You can see the white जो खुल रहा है वो balloon pump है. This is not inside the heart, outside the heart. उसके बाद हमने पहला शॉट देखा एंजियोग्राफी की, and to my utter surprise, although 100% block तो मैं expect कर रहा था जो circumflex artery में है, but same time the LED also had a serious blockage. तो circumflex artery is the culprit artery जिसकी वजह से heart attack हुआ इनको. लेकिन I was equally worried about the artery which is other left artery which is having a 90 to 95 to 97, 98% or 99% or 95% stenosis, and which is supplying a diagonal also, which is also having stenosis. So I took further shots और मैंने इनके right coronary artery देखी. Right coronary artery was fortunately normal, almost normal, mild plaquing. I discussed with the patient's family and they agreed कि भाई, I told them कि हम इसको culprit artery को पहले करेंगे, which is circumflex artery. उसके बाद हमने सोचा कि इसको we will think whether we should whether we should do second artery or not in the same sitting, or we will plan it later on. This is very important, which I tell everybody. This is the Voda catheter. Now it is very well hooked, and now we put a wire. This is the wire. I don't use a torquer normally, and the wire went. Sorry, I was showing my face. This is the Voda catheter. और उसमें सीधे wire डाला हमने. But the important thing again, I want to tell that we don't use a balloon at this point. Wire has gone easily, and I have done a thrombosuction. Thrombosuction with the catheter, and we are sucking out the thrombus. Thrombosuction, Thrombosuction company ka hai. I will show you. And there are 4 passes. We remove this, and you can see immediately after removing the clot, the artery is flowing now. You can see the flow in the artery. 100% artery free. Sister, आपने फेंक दिया क्या? I want to show this. Huh? Is there? So I want to show the thrombus which was removed. इसमें है क्या? Dr. Kanchan, can you please come and show the thrombus? The thighs में. Sister, it is there? Okay, I can see. So I'll show you the thrombus. This is the thrombus, white and red color. दो thrombus के clot है जो remove किया हमने. And because of this thrombus removal, we are able to get the flow. This is actually very important, and it is very useful also. So without putting the balloon, I had done a thrombosuction. This is my normal strategy. And with the help of thrombosuction catheter, we sucked out the thrombus, and now we have done a routine angioplasty. In the meantime, patient also had a bradycardia, which happens because when the flow is restored, it can lead to bradycardia. So we had done a temporary pacemaker implantation just during that time. We should have done it earlier, but we thought it was not required. But it's always better to do it. Okay, so now I have not used a balloon at all, and I have put a stent directly. A direct stent implantation, 3 millimeter into 23 millimeter balloon, a stent, 22 millimeter from Orsero. And this is a very good result. Now you can see the final result. The artery is fully flowing. This is the final result. The artery जो कि पूरी बंद थी, I'll show you the difference. ये artery यहाँ पूरी बंद थी, there was no flow, और ये artery पूरी बड़ी खुल के आ गई. So at the same time, we thought कि we should we do Doctor, 2 minutes. 2 minutes. Sister, 2 minutes. ये artery है जो दूसरी artery है, 95%. Whether we should do it or not, we taking a conscious decision not to do it because culprit artery is required, and angioplasty is always required. Any complication in the second artery can lead to another problem, and heart is already disturbed because of the. You can see it can be hibernating heart. Don't know the ejection fraction must be little low. So I will now talk very quickly to my Dr. Kanchan. Will give a small comment because she was involved in the treatment before I arrived. So what did you see in that patient? Dr. Kanchan, आप ट्रायल में she is in emergency duty as a junior consultant. तो क्या देखा आपने जब आए थे patient?
Patient was very dyspneic. Patient was complaining of ghabrahat and uneasiness and feeling very nauseating at that time. She was very anxious.
These are symptoms of actually acute MI. Patient को pain से ज़्यादा घबराहट होती है, and sometimes they have a sense of impending death also. So acute MI is dangerous, and they diagnosed it well. They did a very good, successful management. They must have given nitroglycerin, and they must have given tramadol, Tramazac as a pain, and they must have loaded with antiplatelets.
Antiplatelet, Lasix infusion, and
Lasix बंद कर दीजिए इनका. Lasix infusion because these patients can go into heart failure, and there's always an increased LVDP which can lead to acute breathlessness and requirement of ventilation. And we avoided ventilation. We have given a non-invasive ventilation, which is a high pressure flow, which helps in restoring this. So in the night, they managed initially, then I come and do the angiography, angioplasty, thrombosuction, and good result is achieved. And we are very happy and thankful to God that we have done a good job. Now the patient who is fully conscious all through. ठीक है आप? कैसी है? ठीक है? Very good. So patient is saying nod. She's on a little flow of oxygen. And so I just summarize acute MI in the middle of night, comes in the right time. We do emergency intra-aortic balloon pump. Then we do the angiography, angioplasty, stent, thrombosuction, and the patient is now will be wheeled out to CCU. This is actually the thrombosuction intra-aortic balloon pump का ये है और then this is the balloon pump जो go जाता है. The machine is different. This is not normally not required, but it's very useful because it increases the diastolic pressure. The diastolic pressure is 170, systolic pressure is 104, and mean is 104. So this way the patient is now doing well. Thank you everyone for watching this video. Prof Dr Vivek Gupta in Apollo on 19th midnight 2 a.m. doing an emergency angioplasty successful with thrombosuction with intra-aortic balloon support. Thank you very much. 19th October 2023.